We interrupt this regularly scheduled program to bring you an important health update. It's Tuesday, the 9th of July. I'm at one of my favorite getaway spots, Bergdorf, Idaho, here in the cabins of Bergdorf. 750-mile ride to come up here and enjoy the hot springs located right down here. So, as you know, if you've been following this channel for a while, about 2 years ago I was diagnosed with prostate cancer. This is the same cancer that killed my dad, who got it at about the same age that I got it, and he ended up passing away in his early 60s. Now, this was back in the late 80s, where treatment was considerably different than today. So, with that family history, I elected for the radical prostatectomy, Da Vinci method, laparoscopic, down there at UC Davis, and that all went very well. And of course, both biopsies did indicate cancer, kind of a medium garden variety of strength. So after your prostatectomy, it's very important to keep track of your PSA numbers. My question to the doctor is, why do you check PSA when you've got no prostate left? Well, you still may have prostate cancer floating around in your system, and that's where the PSA check can pick that up. Especially small amounts after the prostatectomy. So sure enough, after my prostatectomy, initially I showed virtually zero PSA count, and then about a year later I indicated 0.2, and then about 6 months after that, a year and a half total, my PSA was 0.4. Now those are tiny numbers, but it shows a doubling of the PSA count in a 6-month period. So that gets doctors' attention, and the failure for a prostatectomy is considered at 0.2 PSA. If your PSA rises above 0.2, you got to do something about it. So that brings me to today. I'm celebrating graduating after a 6-week course of targeted prostate radiation therapy here at our local hospital in Nevada City, Sierra Nevada Memorial Hospital. Great crew, great program. So after being diagnosed with the 0.4 PSA, we came up with a plan to do targeted radiation therapy along with hormone therapy. This is all fairly common. About 20% of these prostatectomies end up with some follow-on treatments like what I'm going through. And of these follow-on treatments, generally 90+% of these treatments works and knocks the cancer down. I don't really think you're ever cured of cancer. You just manage it through your life. So the radiation treatment lasted 6 weeks. I think this prescription was something like 66 millisieverts dosed over a 6-week period. It's every day, 5 days a week for the 6.5 weeks. So what's that? 5, 10, 15, 20, 25, 30, 33 treatments total. Just a zap on the table. What they do is the doctor does a CT scan of your prostate bed area, and then creates a topographical map, and then goes through and paints by numbers and determines the prescription of how much radiation to give what portion of the prostate bed area of your body each day. And each day you get the same amount, the same dose. The idea being that the radiation knocks down all of your living tissues in that area, but over the course of the day, the healthy tissues recover, and the cancerous tissues do not recover. So you just keep beating them down, right to the edge of causing permanent damage to your good tissues. Stop the treatments, and by then, hopefully, the cancerous cells are knocked out. Now, the hormone treatment, in this case, is Lupron. By the way, virtually zero side effects from the radiation treatment, just a little bit of fatigue. The larger reactions, side effects, by far are from the Lupron hormone treatment. Lupron hormone treatment drives your testosterone down to 0. The idea is the synergistic effect, as they call it, of the two treatments together, whereas it is believed that that testosterone is the fuel for the cancer cells. So if you can remove the fuel and then beat them down, beat them to death with radiation, you can hopefully lick this cancer. And again, these are all very blunt instruments of modern medicine, and this is all going to change in the very near future. In the near future, this will be done with drugs, and in the not too distant future, genetics. Just pull out the bad cells and plug in the good cells, but there's a whole ethics issue with that. But I'm hoping in the future that's going to be the case. So side effects from Lupron are the fatigue, man. Zero testosterone, run around with zero T is tiring. You need that afternoon nap, but you got to keep moving too, and you got to force yourself through the day. With that fatigue comes hot flashes, irritability, and forgetfulness. That's right. You tend to forget things real easy. So you got to be careful with the Lupron. It starts out with a 1-month shot, and then you get a 3-month shot, and then it's done. So all of this is going to take a very long time to see where I'm at the coming out the other end. The Lupron drives the PSA count right down to 0, so you can't get an accurate PSA count until the Lupron wears off. In fact, you cannot get an accurate PSA count until the Lupron wears off 6 months. So it's 6 months after August before I can get an accurate PSA count. August is when it'll wear off, be done. Then you can see how you came out with all of this. Now, as far as the FAA is concerned, the FAA also uses a PSA count of 0.2, a very tiny number, post-prostatectomy, considered the failure rate for these, the failure point for a radical prostatectomy. They use that for the definition of a first-class medical. So I got to get, so I'm off work for a good long time. I'm going to be on disability and collecting well less than half of what I was earning. A huge financial hit, plus the medical bills on top of that. So you got to, young pilots, you got to learn to live within your means. You're only 6 months away from ever coming up to a situation like this. It's going to require you to be off the schedule. So you got to have a big emergency fund built up and live within your means so that you can live comfortably within the limits of your disability payments. So it'll be, 6, 7, 8. It'll be till February at the earliest before I can get back on the schedule, and I have to lobby the FAA all of my paperwork to get back approved for a first-class medical. We have folks at the airline that'll help you get this paperwork through and get that issue resolved. So that's the update, the health update from Bergdorf, Idaho. 750 miles up to here, brought the big BMW R1150 RT. Starting out just with street riding because I've been off-road riding, working on keeping the fatigue levels up, but it's hard for me to go off-road riding day after day after day like I used to do. So I got to take it a little easier. I'll show you the BMW. This big pig. The big 1150 RT. I threw an ad on Craigslist for $4,500. Not a single phone call, so I figured, well, heck, for $4,500, I'll go enjoy it for that much. So I am. Bergdorf, Idaho. I'll show you around here. Check it out. So the hot springs here at Bergdorf start with 2 very hot pools right here, fresh up out of the ground, then pours into the big pool here. Clear gravel, no mining allowed in the pool. Log sides. And then down here is a neat, one of my favorite hillbilly hot tubs with a built-in back massager as the water flows out and down into here. So I'm going to jump in here this morning before seeing what's over those mountains that way.